Powell is not here yet. Gingell is absent with notice. Gershenson? Here. Jackson is not here yet. McGilvray is absent with notice. Nelson?
Here.
Cavell? Here. Joliet? Lubes?
Here.
We have a quorum.
Thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is approving the minutes from September 5th. I have a motion by Commissioner Nelson, support from Commissioner Joliet. All in favor say aye. Aye. Opposed? The minutes are approved. Our next item is approving the agenda. I have a motion by Commissioner Nelson, support from Commissioner Joliet. Seeing no changes or additions, all in favor of the agenda say aye. Aye. Opposed? All right, the agenda is approved. We arrive at our first public comment for this meeting for items on the agenda. Is there anyone from the public wishing to comment? All right, public comment is closed. We have 4 items under communications. The first is a grant application to the Bissell Pet Foundation for the fiscal year 2024 Empty the Shelter event. The second item is an amendment to the fiscal year 2023 Michigan Drug Court Program. The third is another amendment for the Michigan Drug Court Program. And the last item is a report from Oakland Together Mental Health and Wellbeing Nonprofit Grant Program. Who would like to make a motion? I have a motion by Commissioner Gershenson, support from Commissioner Nelson. Are there any comments or questions on these communication items? All right, would you like to prompt the vote on this?
We have 5 yeas, 0 nays.
All right, those items are approved. We move on to a presentation, and we have a presentation by Common Ground. So I would invite you to come to the front of the table. And we have Jeff.
Kapusinski.
Thank you. And our
Thank you.
senator here to present.
Yes, thank you for having us. Would you prefer, may I stand?
Sure.
All right.
Just give me 1 second here.
Sorry.
Share screen. You're not seeing share screen. No. Oh, no. I can't get over to this part of the screen.
This icon to it?
No, it's like right behind here, so.
Move it. Thank you.
Isn't it the power? You got too far.
Thank you all for having me, having us. My name is Jeff Kapuscinski. I am the Chief External Relations Officer for Common Ground. What we wanted to do today is give you a brief update on what we've been up to at Common Ground. You folks have been very supportive. Many of you have come out and toured our facility, seen our programs firsthand. For those of you that haven't, we want to give you a quick glimpse behind the curtain, if you will, as to what's going on these days. I think most everyone here is aware of who we are and what we do. We've been serving the Oakland County community for more than 50 years, providing mental health services as well as substance use services. We offer a team of many dedicated professionals in delivering that care. I think most people know us for the 1-800 number. We now call that the Resource and Crisis Hub. It is a starting point for people entering the continuum for mental health services to help guide them and give them direction in terms of the services that they might need and how to access those services. For many, this is the 1-800 number, the number for which we've been associated for many, many years. At the bottom, you see I've listed something called MyCal and 988. This is a national initiative. And when the state, and that being the Michigan Department of Health and Human Services, needed to implement 988 in the state of Michigan, they came to Common Ground to provide that service statewide. So chances are if someone's calling from the state of Michigan to 988, they are speaking with a Common Ground employee to get that type of urgent behavioral health help that they need. We continue to work out of the Resource and Crisis Center just up the road. This is a look at our Crisis Stabilization Unit, otherwise known as OASIS. OASIS stands for Oakland Assessment Crisis Intervention Service. This is a 24-hour program designed to help stabilize individuals and then move them on to the next appropriate and least restrictive setting. We have psychiatrist coverage here 16 hours a day. This is our highest acuity unit that we offer, and this is a locked environment. We work very closely with our friends in the Sheriff's Department in this program. As we have, you actually can see it here in the very left-hand side of the picture. Those doors on the left are the emergency entrance where we do receive police and ambulance drop-offs. We also offer mobile crisis service throughout the county. People will come out, our staff, when I say our mobile crisis teams, we're sending out 2 people. A master's level clinician, that's someone with a master's degree in either social work, counseling, or psychiatry, or psychology rather, excuse me. And they're paired with a what we call a recovery coach, or a Michigan Peer Certified Support Specialist. That's someone who has lived experience with either a mental health or substance use issue that has not only gotten treatment for that issue, but they've received additional training in how to share their story with others. Recovery coaches are pervasive throughout all of our programming because they help us make a connection with the individuals that we're trying to serve. We also offer or provide service through the Sober Support Unit. This unit is staffed by a paramedic as well as a recovery coach. People typically are in this unit for up to 24 hours where we manage them both from a physical health standpoint as well as an emotional health standpoint, getting them ready for entrance into a residential treatment program. Very important program. If people were to go to residential treatment on their own, chances are they could pick a center that doesn't have any availability. Common Ground has standing slots at area residential treatment facilities to facilitate that process. Crisis Residential Unit. This is a little bit different than most of our programming as this is a residential program. People can stay up to 2 weeks in this program. I tend to think of this as a step-down unit. Somebody who's not quite ready to go home. Maybe they're coming out of an inpatient psychiatric unit. Maybe they're coming out of our crisis stabilization unit. This is a great place to continue that recovery before they enter back into their daily lives. Our newest program is something called Behavioral Health Urgent Care. Currently, this is a virtual program offered through our website. People can click onto the website and see a licensed clinician to help them with any behavioral health issues that they may be having, whether that be depression, anxiety. This program is also staffed with a nurse practitioner. So someone who, say, can't get in to see their therapist or their psychiatrist can get a bridge medication through this program to help get them to their next appointment. As I said, go through the website at commongroundhelps.org. You can click on Get Help. It's a separate process for first-time users as opposed to second and up time users. But the wait time is typically less than 5 minutes for this program currently. You may also know that we are providing services for the Oxford community, and if it hasn't been announced yet, it will be shortly, the East Lansing community. We're opening what is called resiliency centers. Again, the state of Michigan came to Common Ground to provide care and comfort for those communities after the mass violence events that they have endured over the past year. And we are obviously very happy to provide that service to both those communities. So again, how to reach us, the Resource and Crisis Center is located just up the road. We have the Crisis Resource and Crisis Hub, that's a misspelling there, and then our website at commongroundhelps.org. That is my presentation. I'm happy to answer any questions that you might have about Common Ground services. Please.
Thank you. But is it insurance dependent for anyone to receive emergency psychiatric at Common Ground?
It is not insurance dependent. Everyone will at least receive an assessment, an evaluation, and possibly a referral. We are contracting with several commercial providers so that we can provide services to their members. Yes, we are primarily serving the Medicaid and uninsured population, but we have made accommodations for those who are commercially insured as well.
Thank you. Other questions? Commissioner Cavell?
Hey, Jim. Hey. With the Behavioral Health Urgent Care Center, you said it's virtual,
Yes,
but you want to expand it to be
physical.
right.
We do. That was part of our business plan. It has actually been a rather slow acceptance by the community. While we've treated probably over 1,000 people in that program in probably the 15 months that it's been operating, it's not quite the mass yet that we had anticipated. So that is still part of our longer term plan to open a physical location to serve people. But I have to say that the virtual site actually works well for a lot of people who want to stay in their home to receive that kind of care and treatment. But we do have plans to continue to grow that service.
Okay. You're talking about that sort of funding breakdown too. With the new rules for the child care fund with abuse and neglect cases, I don't know if this applies to you, but there'll be like a new ratio for community-centered treatment. Is that anything worth considering or anything on your radar?
It's not currently on my radar, but I will certainly look into it. Yeah, that does sound intriguing.
Do you guys do a lot, you got Matt here, so do you do, what does like state advocacy look like for you? Especially with thinking about like how I would imagine friendly Lansing is to mental health, all things considered, and how there's, we have people come in here that talk to us about how there aren't enough beds and how things aren't going well for people with mental health concerns. Do you ever ask for more money?
We do frequently.
Okay, cool.
Yeah. I think our relationship with the state is very, very good. They've reached out to Common Ground, obviously, to provide services for the 988 line, for the resiliency centers that I mentioned. We're part of the statewide task force looking at crisis stabilization units, that are going to be implemented throughout the state. I think beyond that, next on their agenda will be crisis residential units. So I think that all of that programming really follows the Common Ground model and structure, and we are happy to be part of that process and part of that conversation.
Okay. And my last question is,
Okay.
Thank you. How much of your budget is from OCHN and how much is, right, like Chair said, the Medicaid reimbursement, and how much is like philanthropy or private donors?
I would say that we're probably about 35% funded, 35 to 40% funded through OCHN. Private donors make up approximately 5 to 10% of our revenues.
Okay, thank you.
Is the 8-bed children's unit, is it generally full?
You know, I can't speak to that. That program is being run by New Oakland. I see Christine Burke is here from OCHN. She could probably speak to that
Okay.
better than I.
Thank you. Any other questions or comments? All right, then I need a motion to receive and file the report. I have a motion by Commissioner Gershenson, support from Commissioner Joliet. So I want to say thank you for coming to us to present. I know this was pulled together in about a week, so very well done. Thank you.
Thank you very much. We appreciate the opportunity to address this esteemed group.
Thank you.
Thanks for coming.
Thank you, and perhaps you should invite them to your Oxford Center because
Thank
that
you.
is relatively new.
That's right.
Many of the commissioners have not seen.
Yes, we are. We have a major fundraiser, October 20th. Please mark your calendars. Invitations will be in the mail this week. Called the Celebration of Hope. Each year, we like to award a distinguished member of our community or team with something called the Kay White Legacy Award. For those of you that don't know, Kay White is a longtime board member and volunteer for Common Ground, and we have created an award in her name. And this year's recipients are Sheriff Bouchard, as well as Christine Ruin, who is a volunteer with our victim
Advocacy,
Thank you.
right?
VAP, Victims Assistance Program. Yeah. Thank you.
All right, thank you. Anything else? All right, we prompt the vote.
Thank you so much.
All right, thank you.
Being a former commissioner brought back fond memories of being in the room.
We have 6 yeas, 1 nays.
All right, motion carries, thank you. We have one item from the prosecutor's office, an amendment to the fiscal year 2023 anti-terrorism emergency assistance grant program. Who would like to make a motion? A motion by Commissioner Gershenson, support from Commissioner Joliet. And we have Mary Larkin here to talk about this item.
Thank you. Good morning, everybody. I am Mary Larkin. I'm the Victim Services Leader with the Prosecutor's Office, and we are grateful for the additional award funding that was granted to us by Michigan Department of Health and Human Services in the amount of $68,553. That is in addition to the initial grant award of $87,500. This additional funding will go toward fully reimbursing the 2 positions that are funded in this grant. As you may be aware, this grant is to assist with the prosecution and coordination of victim activities in the Oxford High School shooting case, specifically relating to the shooter's case because he is charged with terrorism. The parents, as you may be aware, are charged with involuntary manslaughter, so their case is not a part of this grant, just the shooter's case. So we're grateful for this additional reimbursement so that the county can be reimbursed for the full expense of these 2 grant-funded positions. I'm happy to provide any further information if you would like. I would just like to echo the prior presenter regarding the Common Ground program of the Resiliency Center in Oxford. Our Oxford case advocates work very closely with the Resiliency Center in Oxford, and they provide phenomenal service for victims in the community, and our advocates coordinate and collaborate with them on many levels. We're very grateful for them in the community. I'm happy to answer any questions that you may have.
Thank you. Any comments or questions? Commissioner Cabell?
Hi, Mary.
Hi, Commissioner.
This is for paying for staff, right?
That is correct.
But you also provide or have provided, right, like mini grants to people that are in between things or people who have been considered victims that need money and you give them money?
There is reimbursement available for the terrorism victims. Those would be, it's a very large number of individuals. It's over 1,800. It's the entire student body at Oxford High School that was enrolled on November 30th, 2021, as well as the faculty and staff. If any of those individuals had out-of-pocket expenses for counseling that was not covered by their insurance or any out-of-pocket expense, there are programs that are coordinated through the Common Grounds Resiliency Center now to reimburse those victims for their out-of-pocket expense. So it's limited to that purpose.
Okay. You don't give money to people for like if they need food or something and they were victims of a crime?
We have resources and we have referrals available for emergency assistance for crime victims, and we've certainly gotten involved in that before with housing issues, but not specifically to this case. We haven't had that come up at all for the victims of the Oxford shooting.
Sure, but just in general, that's something.
We do in general, yes. We have active resources that we can provide for emergency services, absolutely.
Okay, thank you.
You're very welcome.
Any other questions or comments? All right, prompt the vote, please.
You have 6 yeas, 0 nays.
Motion carries. Thank you, Mary.
Thank you very much.
Our next item is a district court recommendation from the 52nd First District. Oh, I'm sorry, I jumped ahead. An amendment to the peer recovery coach interlocal agreement with Oakland Community Health Network. Do I have a motion? I have a motion by Commissioner Gershenson, support from Commissioner Powell. And is Chris here to speak to that? So this is a motion not to exceed $21,000 per year to continue to provide peer recovery support services and authorize the chair of the Board of Commissioners to execute the agreement. The Sixth Judicial Court Adult Treatment has been increasingly receiving referrals for individuals having substance abuse problems. Individuals in the special high-risk population have significant rates of recidivism and are likely to be incarcerated if left untreated. The Adult Treatment Court was developed as an alternative to incarceration for individuals who suffer from mental illness and substance abuse. So this was initially signed and approved, and the budget amendment is not required at this time for funding for these services, but will be included in the Michigan Drug Court Grant Program agreements via the separate resolutions. Any comments or questions on this item? All right, prompt the vote, please.
You have 6 yeas, 0 nays.
All right, motion carries. Now, we have the district court recommendation item from the 52nd First District Court in Novi. Another amendment to the mental health court program with Oakland Community Health Network. And we have Alexandra Black here to speak to that. Right, so let's get a motion. A motion by Commissioner Powell, support from Commissioner Joliet.
Good morning, thank you for having me here. I'm just here to ask for us to continue, actually, we entered into an interlocal agreement last year with OCHN for our liaison for our mental health court, and it's actually for the entire 52nd. I know most of you are familiar with that. We used our grant money last year to fund this liaison. We didn't have enough money to fund her for the entire year. We hired her partway through, so we want to ask for more money in our grant again this year to cover the entirety of her salary, which is why the interlocal agreement would be $92,300. That would cover salary and benefits. We will likely be asking for more than that because we want to expand our mental health court, which is great news. We have so many referrals. We're going to need another probation officer and more things, more items that we can fund for the mental health participants. But in any event, in this case, we want to make sure that we have this interlocal agreement going forward so that it's not an issue when we do ask for those funds, and we hopefully do receive those funds for the position.
Thank you. Comments or questions? Commissioner Cavell?
Where will you be asking for those funds? Is that SCAO or?
SCAO again.
Okay,
Mhm.
cool.
They did, so last year we received the same amount that we did the year before, and we went back to them after we were able to hire the liaison, and they did give us more money after the first quarter, so we're hoping that they just give us enough out the gate this time, showing that we were able to spend all the money, no problem, so I think that we probably will be able to get more, and if we have to ask for an amendment, we'll just continue to do that.
I had another thing.
Yes.
Just because I've been thinking about it with the state stuff, I mean, do you all ever advocate or like lobby the state or SCAO or people on those relevant committees for more structural funding instead of kind of what you seem to have to kind of shuffle money around if you're lucky to get more money?
Yeah, we're always shuffling. So I just happen to be on the board for the Michigan Association of Treatment Court Professionals. I
Yeah.
have been for like 10 years. And that is one of the things that we do as a board is we're constantly trying to work with SCAO about making sure that the courts have the proper funding in the first place. So yeah, so we're not crossing our fingers and hoping that we can continue our program. They did a presentation, SCAO did a presentation at our last annual conference, which had like 1,000 people at it. And one of the things they stressed was that there are courts out there, not ours obviously, but there are courts out there that ask for more money than they probably need, and then they don't utilize the funds and they don't give them back. So they stress that they're keeping this really tight eye on how much is actually spent per year so that courts like ours don't have to continue to ask and beg and borrow and steal, basically. So yeah, I mean, we do advocate for that, our organization, the MATCP, separate from my regular job. And then as a 52nd as a whole, we have expressed and advocated and, noted, particularly here, because of the way our structure is, most district courts just, go to their local, and it's a much easier process, although I've been very fortunate, I knock on wood, you guys have been great about, Barbara helped me get right in today, so, we're lucky in that way, but they don't know that, they don't know that I don't have to wait a month or 6 weeks or, pray that you guys approve it, so we have expressed that to them, that our structure is different, and we could get caught in this loophole of where we don't have funding for 6 or 8 weeks if they don't move things along. Now, whether or not they care is a whole nother thing,
Yeah, right.
we do advocate.
Okay.
All right, anything else? All right, prompt the vote, please.
You have 6 yeas, 0 nays.
Motion carries, thank you.
Now that you voted for me, I wanna mention that we have our graduation coming. And we'd like everybody to come to our first mental health court graduation, that would be great.
Where is it and when?
We're gonna be holding it, we were gonna hold it here, but we think that might be a little too public for some of the people that are in the program, so we're gonna have them at the individual courts, so I'm gonna send something out to all the commissioners, and then maybe you could pick one that's, at one of your local district courts or closer to your home.
Good idea.
Thank you.
Thank you.
Thank you.
Our next 7 items are Sheriff's Office recommendation. The 3 are items, agreements with Oakland Community Health Network. 1 is an amendment, a few are applications and acceptance for funding. Our first item is an agreement with Oakland Community Health Network for Jail Alliance with support JAWS program. Yes, correct. So I have a motion by Commissioner Nelson and support from Commissioner Joliet. So, well, welcome to our under sheriff and Guy up here.
Good morning.
Good morning.
So this first item is, like you said, for the JODS program. It's a continuation with OCHN paying the county and the sheriff's office 100% for 1 full-time inmate caseworker position and 2 general fund, general purpose, part-time, non-eligible positions. So you'll notice that we have 3 agreements today. The JAWS and the MAP program, we used to have a combined agreement. But as we've added more programs, we decided that it was probably cleaner if we have a separate agreement for each one that outlines what needs to happen in each one. Cause on some of them, they were crisscrossing where OCHN is paying us, and then we have the last item that's the new agreement for the opioid settlement is the county paying OCHN, so we didn't want to mingle those together, we wanted them all separate and clean.
Thank you. Any questions on this item? Commissioner Cavell?
Cause you were mentioning like, yeah, who is paying who in this one?
This one is OCHN paying us 100% for 1 full-time and 2 part-time positions.
Okay, got it. No, there's no mutual aid for that? Alright, cool.
Alright, next item is another agreement with Oakland Community Health Network for Medicaid assisted treatment physician reimbursement.
Okay, so this agreement is continuing a full-time inmate casework position. OCHN is paying 60% of this position. We are currently waiting to find out about the other 40% that was included in the community corrections grant application. So we anticipate that funding to get approved, but it's still pending at this point. And this covers MAT treatment for in-county residents.
Thank you. Any questions?
Well, I guess just to mention,
Commissioner Cavell?
this is also something that out of the $193 million sheriff budget we'll be voting on tomorrow, 0 of their dollars is coming from.
Thank you. Our next item is an application to the Michigan Commission on Law Enforcement Standards for the Public Safety Academy Assistant Program for August 2023.
Yes, so this is a new program from the state of Michigan. This is our second time applying for recruits in the academy, and we are eligible for $96,000, so we're asking for your approval to apply.
Did we do a motion? We will at the end. Yep, I think we all like the sound of $96,000.
We do too.
Any comments on this item? Next item is an amendment to the Michigan Commission on Law Enforcement Standards for the Public Safety Academy Assistant Program, again, for January 2023 Academy.
Yeah, so this was our initial program that we applied for. And what they had done, they had capped the amount that we were eligible for at $4,000 per recruit when we initially applied. And then since that time, they've changed the language in the Public Act. They've revised it to $24,000 cap. So this is an amendment to our first acceptance to accept an additional $94,450.
Thank you. Comments?
Question.
Sure, Commissioner Cavell?
So this is going to pay for recruit or trainees to their salary?
In the academy, yes.
Okay.
Yep,
Do they get paid the,
up to
Yeah.
$24,000 per recruit, so it's capped at $24,000.
okay, there isn't other monies that come into pay if they get more than that in their training session? So I don't know how much a recruit makes when they're in the academy. So do they make $24,000 salary and benefits while they're being trained?
Depends on what level we hired them at, if they're
Okay,
base pay. When we send them to the academy, it depends on what step they are in their career.
okay, understood.
And previously, we paid for it, and now we're
Right.
actually getting reimbursement, $24,000 per person, so
Okay,
it offsets the cost for us.
thank you.
Alright, next item is the third agreement with Oakland Community Health Network for Medicaid assisted treatment expansion.
Okay, so this is a new agreement with OCHN, and this is actually the county paying OCHN a not to exceed amount of $478,600, and this is to expand the MAT program in the jail for out-county inmates as well, so everybody has the same access to MAT treatment.
Okay. I wondered about that with the first one, but that was explained in this one, so. Any other comments? Yeah, Commissioner Cavell?
Do you expect this to, maybe this is an OCHM question, but do you expect this to stay at 478 for like the duration of the opioid settlement monies, which is almost 20 years, or do you think is it flexible, or do you think it'll go up?
This only goes through September, this is only for one fiscal
Yeah.
year, so I'm assuming we'll address it and we'll look at the needs each year and it'll be evaluated at that time.
Okay.
Our sixth item is accepting 2024 funds from the Automobile Theft Prevention Authority.
Okay, so this is our annual grant for auto theft. The good news is typically it's a 50-50 grant match, and this year it's a 60-40, where they are funding 60% and we're funding 40%. So the total grant is $2.5 million. It's in cooperation with Farmington Hills, Hazel Park, Royal Oak, Southfield, Detroit, and the city of Pontiac. And then each participating agency pays their own match.
Thank you. Comments? All right, our last item is an agreement with Oakland Schools for the 2023-24 school resource officers.
Okay, so this is a new agreement. Oakland Schools has asked to contract with us for 4 school resource officers. This is using the new template that was approved by the Board of Commissioners, including the new contracted rates. And they want a position for each of their campuses. So they have 4 campuses, one at the Northeast campus in Pontiac, Northwest in Clarkston, Southeast in Royal Oak, and Southwest in Wixom.
Thank you. Commissioner Powell?
So all contracts will be separate from the city, or will Pontiac's be unique per the mayor's request of keeping contracts separate?
At this point in time, Pontiac is the only one that has it separate. All the other municipalities are continuing through the regular law enforcement agreements.
Okay, thank you.
Mhm.
One more question.
Oh, sure.
Do we have, well, never mind, that's offline, but just know I'm gonna follow up with you all and Patty regarding the Pontiac School District.
Commissioner Cavell?
The 4 locations, this is where students go?
Yeah, they're technical campuses.
Okay.
Tech campus.
And so in the Schedule A, it says that it will be $686,000. But in the draft something or another, it said it would be $427 for employee, like cost and benefits and materials.
Okay, that's the usually I think that's the HR write-up, that's
Yeah.
for illustrative purposes only and not the actual cost, because that's the position cost, not the contracted rate that has all of the other elements included.
Yeah, I noticed that because it has a little asterisk. Why do that then, if it's not like worth referencing? What is
HR
this?
did it on a request from commissioners in the past, so
Say again?
HR is doing that on a request from commissioner from the past.
Oh,
So anytime new positions are created, there's an HR write-up
okay.
that comes from the HR
Yeah,
department.
but before there wasn't that illustrative budget breakdown, but commissioner asking the best and now they're including it. This is why the asterisks is
Okay.
just for illustrative purposes.
It doesn't include any operating costs, it's just the straight cost of a position.
Okay. Alright. Fair, and then I looked at something else that said the cost would be $663, but then it also says it's $686 somewhere, so what's the real number?
Okay, so typically, so if you look at Schedule A,
Yeah,
it has 4 patrol investigators. That's
Right.
the annual cost. Our law enforcement agreements are January through, it's a calendar year.
Yeah.
The budget amendments are fiscal year.
okay,
So there's always,
There
they're
we
never
go.
gonna be exact because we budget for the
Yeah.
fiscal year, so they're prorated accordingly.
gotcha. And then my last question was, it's a 1-year contract, right?
Well, it's through December when all of the agreements are up. And then we'll
Okay.
revise, we'll come back with new rates and new agreements for everything.
Okay,
So yeah, it was the timeframe set by the board when you approved this new school
gotcha,
agreement.
okay. Alright, thank you.
Anything else? Okay, so we have 7 items under the sheriff's office. We have a motion and support. Would you prompt the vote for those items?
You have 6 yeas, 0 nays.
All right, thank you.
Thank you.
Thank you.
We have 2 items under public services. The first is medical examiner forensic case management system upgrade. And the second is from Community Corrections, an amendment to the agreement with Oakland Community Health Network for providing trauma-informed group programming. Who would like to make a motion? I have a motion by Commissioner Gershenson, support from Commissioner Cavell. And we have Cass Merica here to talk about the forensic management system.
Thank you. In 2019, we had our program rebuilt from the bottom up, and over the course of the last 4 years, we've been using the program, and we've recognized some upgrades that need to be done, which will allow even more efficiencies than we've gained from the original program, and add some security. In addition, it will help me with the reporting of certain statistics that I get a lot of requests for. In order to do this, we looked at everything, and it would be about $80,000 to upgrade the program. And so in order to do that, we wanted to request the money be moved from the general fund to the IT line item for that improvement.
Thank you. Any questions about this item? What? Just stay right there.
I will.
Okay. Our next item is from Community Corrections. It's an amendment. We don't have anyone here to present to it. So as the amendment, it's an item not to exceed $45,000. This item provides assessments for people in our community corrections area now. So Oakland Community Corrections is reimbursing OCHN for this grant. Does this make sense to everybody?
Yeah.
Okay. All right, any questions on the forensic case management or the amendment? Commissioner Cavell?
For the forensic management, will this be something that, is it the type of thing that the other communities that you contract with will be able to use, right? Like Livingston County or Lapeer?
So we contract with Lapeer County, so they currently use the program, very minimal. So they usually call everything in and our investigators input all the information. They have access to upload like photographs and stuff like that, but that's about all they use on it. So the enhancements we're asking for are really for our staff, not for the external.
Will this cost be reflected in like the Lapeer agreement when it comes up again?
Yeah, when we evaluate the agreement again, we would look at all the costs that we've absorbed through all of that. The revenues are up from Lapeer right now, I can tell you that. So unfortunately, they're busier.
Yeah.
We're from there, so we recognize that, but these enhancements will allow, again, the investigators to get more information in quicker, and not only that, our clerical staff won't have to do it. They can, instead of having to do it on paper and in here, they can do it all here, so that's why we're asking for that enhancement.
Okay, thank you.
Anything else? All right, prompt the vote, please.
You have 68, 0 nays.
Motion carries. Thank you.
Thank you.
Our next item is from Health and Human Services. There are 4 items that are acceptances, 3 acceptances and 1 amendment. So accepting from the Michigan Department of Health and Human Services fiscal year 2024 Local Health Department Comprehensive Agreement. Again, from the Michigan Department of Health and Human Services for the 2024 Emerging Threats Agreement, an amendment to the subrecipient agreement with Catholic Charities. And the last item is accepting the Michigan Department of Environment, Great Lakes and Energy for the non-community public water program. Commissioner Joliet motions, Commissioner Powell supports, and we have Leanne Stafford here to address these items.
Good morning, everyone. So I'll start with our comprehensive agreement, or some have maybe heard it called the CPVC. It's changed names a couple times over the last couple of years. This is our large operational grant from MDHHS. It's just over $12 million, but that actually funds 30 programs from our food investigative program to WIC to our nursing program. So it's our largest grant that we receive from NBHHS. We are receiving just a tad bit more than we did last year. And this does include a subrecipient agreement with OSA to operate some additional WIC clinics in the community. We are requesting 3 new special revenue positions with this grant. We're actually converting them from contracted positions to county special revenue positions. And most of those are in our PrEP program. So yeah, that's it for that one. Do you want me to take questions in between each one, or do you want me to keep going?
Take questions in between each one.
Okay.
Commissioner Cavell?
Thanks, yeah. I think you might have answered the question already, but you have 2 part-time deletions. Is that?
Yes.
Why?
So that was just due to some funding cuts in those programs, and they were vacant. So at that time, we cut them. Now, if we receive, sometimes during the middle of the fiscal year, we'll receive additional funding. If that's the case, we may bring those positions back to fill those gaps.
Funding cuts?
Yeah, sometimes the state doesn't give us everything to run some of the programs. And so, again, you know, bringing in, like, let's say, for instance, that clinical health specialist that was in our PrEP grant, we may, instead of having a PT&E, we might bring a full-time person in special revenue, which allows us to even provide, you know, sometimes more access to services than 2 part-time people. And so the other one is in the Transforming Youth Suicide Prevention Grant. At this time, we did not receive the funding, but again, a lot of times throughout the year, we'll have amendments that will allow us to get additional funding. So I'm not exactly sure about the Youth Suicide Prevention Grant, but a lot of times PrEP will come back, the state will, and provide us additional money. And so we'll bring part-time staff back in.
Okay, just to mention then, we all just voted to approve the sheriff's budget going up by more than $1 million. And they're talking about cutting suicide prevention for youth and HIV assistance.
Is that from the state or from the county, the cutting the program?
Well, they didn't get a grant from the state, and so then because there isn't enough county money for them, they then have to cut the position because it can't be county funded based on priorities. Wherein what we just did is vote to help the sheriff get more money from both the county and the state. So it's, 6 one way, half dozen the other.
And
Commissioner Powell?
if something like that could be staffed per the county came up with the funding, how much is that, Leanne? Like, what is that grant, what was that grant covering?
I would actually have to look into it. It was focused directly around youth suicide prevention. Now, we do have a full-time staff health educator that's county funded that does try to straddle some of those programs when we lose funding. Obviously, the priority for one PT&E health educator focused on youth suicide is very different than one full-time trying to juggle multiple harm reduction, youth suicide in general. I would say a part-time person is probably between 50 and 70,000. I can definitely look into that and get that back to you.
Yeah, I think it's worth us knowing stuff like that as far as that amount, because as we know, that's not a lot. And if it's something that is pertinent that we need to still keep in our division, I think we need to go find the money. And we know that we can somehow find money. So I think, Leanne, if you could, because Cavell did make a great point dealing in comparison with our sheriff department or just departments in general. But if that is something that you really do need us to kind of find funding, can you please let us know, Stafford? Please.
Yes, I will. Yeah, I will look into that and get that information back to you.
Okay.
And I'd be interested in seeing the job description.
Right.
Because we have services available through OCHN and Common Ground to address the same. So is it a duplication of service or is it an enhancement of service or what? What specifically does that person do or did?
Yeah.
Commissioner Wilson?
Good point. Is this time sensitive?
I could probably get this back to you pretty quickly, what this individual did along with the job description. I don't have that information right away. So I don't know that it's time sensitive because like I said, we do have a full-time person that goes across a couple of different, I guess, priorities, right? Suicide is one in the whole county. So she works on youth and adult, and then she also does violence prevention. So she does a lot of things. So some of it is getting taken care of. I just don't know this specific grant, what her endpoints were and what her goals were for this. So that's why I'm saying, let me take a look at this and get back to you on it.
Okay.
You know, that sounds fine. I just wanted to know if we had to act under any particular time frame or whether this can go to our next meeting.
Are you talking about the entire comprehensive agreement? I'd like to vote on that today
Well,
because this is the
no,
biggest.
I'm specifically talking about the suicide piece.
No.
No, I'm prepared to vote for sure, but I'm wondering.
I don't think it's time sensitive for that part-time position.
So we can get the information that we've asked for
Yes.
first.
Yeah.
Anything else? Okay, our next item is accepting the grant for the emergency threat agreement. So I have a motion that is covering that. So
Oh, okay, so I just need to, okay. So this grant is our emerging threats. And so what NDHHS has done with this is they've kind of put any potential threats that we may be looking at, like PFAS, obviously COVID, if we were looking at hepatitis A, which, you know, we most recently had a potential outbreak with that, this money helps fund some of those activities. And so we are getting $6,263,000, I don't know, just over 6 million. Geez, I can't write that today. I can't say it out loud. And obviously a lot of what we lost was around COVID. Obviously we're kind of starting to, go back a little bit on our operations. However, with a 135% increase over the last couple of weeks as we've been looking at this, we are continuing to work in the community, right? We work in really around some of the high need areas like nursing homes and specialty care units, looking at opportunities to help them and some testing. Our new booster will be coming out soon, so we'll be offering those, and so we'll be out in the community and also offering them in our clinics. And then our lab project, which we've talked a little bit about our regional lab. We're a backup to the state, so they provide money there if we provide backup testing. And then also our wastewater project, where, we talk a lot about the COVID project as well as others, as we're looking at that being a new way to really look into the community about maybe what's coming. So that's what the money is here. Again, we did get a little bit less, but we feel like most of it is actually all of it was in COVID response, so.
anything else? Okay. Move on to the amendment for the agreement with Catholic Charities Southeast Michigan.
Yes, so this is an extension of our subcontract with Catholic Charities to provide, we're really looking at social determinants of health questionnaires and gathering data. And so to do their work, they had asked for a little bit more money and an extension in their contract through September, and we were able to make that work with the state. So this is just an amendment to provide them a little more money and also extend the deadline to gather that data.
Thank you. Any questions? All right, our last one is the agreement for the non-community public water programs.
Yeah, so this is our operational grant with Eagle that really works with our well and septics and campgrounds. So this is for the full fiscal year. It's just under $750,000. We are actually creating 2 new sanitarian positions that are being requested here. They were funded as contracted positions, but we're actually going to make them special revenue county positions moving forward, and this is approved.
Thank you. So this is non-community, you mentioned campgrounds, and what else?
Yeah, so non-community water supply, that is what we call our type 2 water supply. That's any commercial location that serves at least 25 people a day and they're on a well. So we have over 800 systems in Oakland County that we monitor on a quarterly, annual basis. And then we also do long-term monitoring. So if an area of contamination has been identified, the state pays us to take a sanitarian or send a sanitarian out and take those samples and monitor for those. This also pays for public swimming pools. So if there's an outdoor pool, those are licensed and inspected. Even indoor pools are licensed and inspected, and then septic haulers. So those haulers that you see that go in and pump septic tanks, we actually monitor and inspect those. So that is what this money pays for.
Thank you.
Sorry.
Any questions on this item? All right, so we have 4 items under Health and Human Services. Would you prompt the vote, please?
You have 6 yeas, 0 nays.
All right, motion carries. Thank you, Leanne. We arrived at our last public comment. Is there anyone from the public wishing to comment? Seeing none, public comment is closed. There is no other business to come before this committee, so I will adjourn the committee at 11:59.
Nice work.
Thank you.